Well, hello and welcome everyone to our EllieMD live educational series. We are so glad you're here as we continue our mission to help people live healthier, longer lives. At EllieMD, we go beyond telehealth. We're building a community rooted in education, innovation, and personalized support to empower your wellness journey. Today, we're honored to welcome back Dr. Josiah Wagner, a leading voice in regenerative medicine, peptide therapy, and hormone optimization. Dr. Wagner's journey began at just 16 years old after a severe back injury left him facing a future of chronic pain. Refusing to accept that as a story, he dove into the world of peptides, stem cells, and functional healing, launching a lifelong mission to help others recover and thrive. Now, as Director of Clinicals at RX Reinvented, Dr. Wagner trains providers across the nation in cutting edge therapies that merge modern medicine with the science of longevity, from weight loss to hormone health and total body regeneration. Dr. Wagner, thank you for being here and welcome back.
Hey, thank you for having me, honey. It's always a pleasure to be here and be able to share with this wonderful community. So thank you.
Oh, thank you. Just take us back for first-time listeners, viewers, for people new to our community. Can you just share a little about your story, your background, how you ended up doing what you do, and then we'll get into the peptides and everything that we're going to teach about today.
Awesome. So I'll kind of give like the Cliff Note story of my own personal journey in, alternative medicine, peptide therapy, hormones, just similar to what Honey shared. The biggest catalyst for my change was at the age of 16 because I was a competitive gymnast. And not only was I a competitive gymnast, but like that was my life and identity at the time. And I did suffer a pretty traumatic injury that left me in chronic pain. And not only did it leave me in chronic pain, but it left me without a sense of identity. And at the age of 16, that's just like really tough because, you're always like looking for something like who you are. And at that point, everything had kind of been taken away. And I went through the whole Western medical system, went to PTs, MDs, DCs, had x-rays, MRIs, and like no one could really tell me what was wrong with me. So that was again another exposure to sometimes there's so many people that go through this system and don't have answers and they feel so hopeless. So to feel that hope at like such an early age, like really impacted me to the point to when I did start to find the answers and did start to feel a difference, I couldn't help but share it because there
Mm.
were so many people around me just suffering or just accepting what it is that the doctors were telling them without really experiencing full healness and restoration. And I'm excited to share about these peptides today, especially like BPC, because those ones have really helped me along my healing journey with the back injury and other injuries that I've had as well too, personally and with patients. It's really like a fundamental one that most people can benefit from.
I love that. And you're right, our sick care systems all around symptom management, not getting to the root cause. So, and I love that you started your healing journey. You started with yourself, and that's how you ended up here. Thank you for sharing that story. And we have to ask, is your pain gone? Are you fully healed, would you say, at this point?
I mean, to a certain extent, like I'm not in the chronic pain anymore, but if I decide to do like a couple flips here and there, it will flare up. So I'm like pretty active, like with weight training, as well as like sometimes I'll like do a flip or something or play with my nieces and nephews, and I'll feel a twinge here and there, but nothing comparison to like what it was. It's completely like night and day.
Well, if you guys were at the Florida retreat, you've seen some of those flips. We've seen your moves, Dr. Wagner. All right, let's get started. Share with us for anyone tuning in for the very first time. We saw Sherry saying breakdancing. Yes, we saw that. Um, for anyone tuning in for the very first time, can you share with us what peptides are? It's just, we hear this term, peptides, like collagen's a peptide. What is a peptide, and what makes these sort of therapeutic peptides different from what's commercially available?
Yeah, so people have probably been introduced to the term peptide in a couple different ways. They've probably been introduced to it through like collagen peptides, which is a supplement that you take. And then what we're referring to specifically is in the therapeutic peptides are the injectable forms. But peptides in and of itself, they're small chains of amino acids. Now, if you continue to build upon those peptides, that's going to make the proteins, whether it's the therapeutic injectable or the kind that people take, inside like their coffee or their shake to help with different things. But essentially, what they are is they're these biological messengers. And as these biological messengers, they send signals directly to the cell. So that's what's really cool about the injectable or the therapeutic peptides is we're affecting your body at a cellular level. So we're not just treating symptoms, but we're affecting the whole body and how it's communicating to itself. So we're basically like fixing everything systemically throughout the entire body because we're getting to like the root issue, which makes it more powerful than most other therapeutics, even like supplements, because supplements, a lot of times you got to take them orally. They have to be digested and assimilated. That takes time for your body to assimilate it. Peptides are almost like you feel them almost like instantly, like right away, because we're getting directly into the bloodstream, right to that cell to cell communication. And the cell is responding right away because the peptides that we're using, they're already naturally made or found in the body. Your body already has receptors for BPC. It has receptors for GHK. It has receptors for the GLP. So like these are things that your body already recognizes and knows what to do with. So yeah, that's a short introduction of what peptides are basically.
I love that. I love that you went there because unlike synthetic drugs, your body recognizes these messengers, as you could call them. So it knows what to do with it, and we'll dive into BPC and everything else. But it's like, so what does it do with what it doesn't use? Like, let's take BPC for as an example. What does it do with everything else that it doesn't necessarily use, or Somorelin, for example?
I'm sorry, what do you mean by that? What it doesn't use?
Well, unlike synthetic drugs, can you compare the two? I just want you to do a deep dive of comparing
Okay,
synthetic drugs
I get it
to
now.
peptides. Yeah.
So again, like peptides with them being these signaling molecules, improving cell to cell communication, a lot of these synthetic compounds, they act to suppress a symptom or block or stimulate or alter like a biochemical pathway. I'll give a couple examples. So like, for example, like BPC 157, there's multiple purposes for that. It's known to like increase the healing process, everything from ligaments to tendons to muscles to joints, even like gastric ulcers. It's been shown to help heal gastric ulcers within the stomach because BPC is synthesized from the gut. So with that being said, you can take BPC 157 for, a type of inflammatory issue, whether you got like shoulder pain, elbow pain, something going on with your gut, and it's going to balance the whole system. There's not going to be any negative side effects because it actually is also neuroprotective. So it's actually balancing your serotonin, dopamine, GABA. So it's balancing all these chemistries within the body, as opposed to, if you want to take a conventional medicine, let's say like an NSAID for the inflammation or the joint pain, because you're just trying to get some relief, it is going to knock down that inflammation because it blocks those inflammatory pathways. But the problem is all the other negative downstream effects because the NSAID inhibits what's called as prostaglandin, and prostaglandin is super important for gut health. And when you do BPC with dealing with the inflammatory response versus the NSAID with the inflammatory response, BPC is helping with the inflammatory response in a way of giving the body what it needs. The NSAID, with it blocking it by shutting down that inflammatory process, you're actually shutting down the body's ability to heal. So you're actually shutting that off as well too.
Yeah, I meant it more for example, growth hormone versus taking Somorelin. It helps your body's natural production of growth hormone, and what it doesn't need or use, it doesn't use, right?
Well,
So,
yeah, so in terms of like the growth hormone peptides, like Somorelin, CJC, tesamorelin, these all fall under what's called as growth hormone secretagogues. The way that they work is they send a signal to the anterior pituitary gland to start the production of growth hormone. And when you're getting these growth hormone releases or production, it's always within a physiological level. instead of a super physiological level. And it's also based off of what's called as a pulsatile system. So you don't just have like growth hormone dripping throughout your body all day. You're getting like small pulses anywhere from 3 to 6 times throughout the day, your highest pulse at night. Now, if you look at that versus taking synthetic growth hormone, HGH, where you're taking it, you're creating a continual pulse instead of like little pulses throughout the day. So it's overriding that natural production. And when you have that continual pulse, the problem is other systems, other hormones, other enzymes are regulated by that natural pulse of that growth hormone. But when you have a continual pulse, it literally starts to throw everything else off within, it sets off like the timing of everything else within the body. And you may not feel that right away. Like you're probably definitely going to feel better from taking the synthetic growth hormone, but the longevity of it is just not there.
Mm, mm. Thank you for explaining that. Um, let's talk about GLPs. We want to touch on a couple of different peptides today, from GHK to GLPs, and thank you for touching on Semorlin. With the rise of GLP-1 medications, how do you help patients maintain muscle and metabolic health during weight loss?
So primarily, and you can look at like these new GLPs that are coming out, like these 4 and 5 stage agonists, and how they're kind of like pairing them together with these myostatin inhibitors. But the biggest thing that I do when using like a GLP-1 or a GIP is, again, we got to look at what it's doing chemically within the body. Basically, what it's doing, it's helping with that inflammatory response. It's helping with that gut dysbiosis. It's helping to calm down a lot of that food noise. And it's slowly putting you in a calorie deficit state. What that calorie deficit state produces is that's what starts to produce the weight loss. When we look at weight loss, there's two different types of weight to lose. There's muscle, and then there's fat. So when you lose total weight, for each person, they're going to lose a different percentage of muscle versus fat. And the goal is to maintain as much muscle during this time as you can, because as you're losing the weight, we want to maintain what's called as metabolic health. Metabolic health is represented by the density of the amount of mitochondria you have within your system to produce energy. And your muscles are the most dense. They're considering muscle actually an organ now, the most dense organ in the body that maintains these high levels of mitochondria. So the one way that we can kind of guarantee that we kind of flip the script in terms of muscle preservation and fat destruction, or the weight loss from the fat, is we add these growth hormone peptides, like for example Semorlin, because that the way that Semorlin works, it helps the body hold on to lean muscle mass. It's also going to improve your levels of deep sleep, which we know sleep is highly, highly important in terms of repair, recovery, weight loss. It regulates your hunger as well too, like your leptin and ghrelin levels, which control these undesirable, like hunger attacks that we get. And then it also brings down that inflammation. So that's like my favorite way in terms of like the peptides. The other thing that the patient can do is definitely start to increase their protein so that their body is maintaining muscle mass as well too, because protein is muscle sparing. So those are like the first ways that I start first with most patients, because I could add the whole kitchen sink to them, but you want to start these people slow and see how their body is responding so that you can really get them dialed in. You don't want to like overwhelm them. You don't want to overwhelm the system in the beginning.
Mm. Thank you for touching on that. And guys, Ellie just launched its protein powder, so make sure you check it out. Important, very, very important as you're losing weight. But
Yeah.
let's take it back, and I should have started with this question. I get this question asked all the time, and maybe you could do a quick overview. If you have significant amount of weight to lose and you're starting your GLP-1 journey, which one would be better? Would it be Tirzepatide or would it be semaglutide? And can you tell us the difference between the two
Yeah, I
peptides?
mean, I'm going to be biased right there and start with the Tirzepatide just because it's affecting two pathways as opposed to just like one pathway. So semaglutide is just a GLP-1 agonist as opposed to Tirzepatide where it's going to be a GLP-1 agonist plus a GIP, which this starts to function more within that metabolic system. And there's typically like less side effects. Semaglutide people can feel some nausea in the beginning. So I'm gearing more towards starting people with Tirzepatide. If like I had a choice, I would start more people in Tirzep over the semaglutide for sure for starting for the first time.
And how
Just
about when it comes to lipolysis, fat loss? Um, which one would you
less
recommend?
side effects, so then the patient's going to be more adherent to it. There are some unique situations where you would use semaglutide over tirzepatide, but not in terms of weight loss. It's more in terms of actually like addictive behavior because they're seeing that not only the weight loss, but it's affecting people's craving for addictive behavior in terms of like smoking or gambling or any type of destructive behavior. I would potentially maybe use like a lower dose of semaglutide twice a week because that has like a strong neurological effect. But in terms of like weight loss, definitely be tirzepatide first.
Interesting. Now, you mentioned Semorlin as a great product to pair with GLP-1s to optimize and maximize your benefits. Are there any other peptides or, for example, NAD, anything else you would pair with GLP-1s to maximize its effects?
I mean, we could do all of them. You can do everything. No, no,
Any,
no, seriously, I'm very serious because these peptides have so much spillover in so many different systems. Like there's so much overlap with them. Like if I took like BPC, if I had TB, and then if I had Semorlin or even like GHK, they create like three overlapping circles that really like bleed into each other. So there's almost not like a wrong or right place to start. It's really just creating a protocol for yourself where you're more like cycling through these things as opposed to being on them consistently. Because when you're cycling them, you're working a little bit deeper on different systems, so it helps you not to plateau. Like, so for example, let's build a dummy stack for someone. So someone wants to lose weight. We're going to start them on tirzepatide. They have quite a significant amount of weight to lose. So what we're going to do is we're actually going to pair that with Semorlin because I want them to hang on to that lean muscle mass, and I want them to be in more of like a fat burning state because they have more significant weight to lose. So I'm going to run them on that Semorlin for about like 12 weeks paired with that one. Next, though, after that 12 weeks, I'm going to go in and add BPC 157, TB 500. Now, the reason I'm going to add those ones too is to help with inflammation and joints because people who have a lot of significant weight, they typically have like joint issues, cartilage issues, elastin issues within the skin as well too, because actually like BPC and TB work on that one as well too. And sometimes like you'll start to like lose weight consistently in the beginning and then you'll almost like stop. Your body will almost like it'll hit a point and stop. So we're going along the journey here. We hit that 12 weeks. You're almost about to stop in the amount of weight that you're losing. So then I add that BPC and TB 500 because what that does is if there's a significant amount of inflammation within the patient's body, they're not going to be their body's not going to feel safe to where it can drop into a weight loss state. So you're not going to drop into lipolysis. So actually the TB part of it actually kind of like indirectly because of like the inflammation modulation as well as the immune system modulation that it does, it helps get that person to continue to lose weight or drop into that lipolysis state because it really drops down that inflammation within the body. So that's what I would do next with that. And then I would just kind of like switch back and forth between like Semorlin and that BPC TV 500 stack. And then you can kind of like throw in whichever ones you want. There's a lot of different ways to pair these. BPC TV actually combines really nice with Semorlin if you want to run that as a cycle too, because With the Somorelin, you're going to have more growth hormone within the body, but the limiting factor is of how that works is the receptors that you have to receive that growth hormone to activate it. What the BPC does is it actually increases the amount of growth hormone receptors that you have, so it amplifies the effects of that Somorelin, and you get a greater result. So it might be good to run Somorelin by itself first, just to see how your body responds. Run BPC by itself first, see how you respond, and then run them both together, because then you really see the amplification of how they work when you start to layer them. Also,
Mhm.
with the BPC and the TB500, you can also add GHK-Cu. So,
Well, before we touch on that, I just want to take it back one step. First of all, for someone hearing lipolysis for the first time, can you explain, because we've used that term a couple times, can you explain what lipolysis is? And then I want to just take it back and talk a little bit more about BPC. So let's start there, and then we could talk about GHK.
so lipolysis just means like the destruction of fat. It's like the breakdown of that subcutaneous fat within your body. Lipolysis is basically like breaking down. Genesis is always the creation. So lipogenesis is the creation of new fat, as opposed to lipolysis. Lipolysis is the destruction of fat, where your body starts to use that as fuel and break that down.
Okay, so you touched on BPC and how it can help and pairs really, really well with GLP-1s. But can you also, I mean, we mentioned that it's derived from the gastric juices of the gut. Can you touch on how it helps with the gut lining as well and helps repair the gut? And that can also pair really well with the GLPs and maximize weight loss.
Yeah, so I mean, BPC itself, when we look at the structure of it, it's a 15-chain amino acid that was first synthesized and discovered in the gastric juice of the gut. Now, when you take it, whether it's oral or injectable form, because the BPC can be used either oral based or injection based, because it is like one of those smaller amino chains, it has different effects within the gastric system. One, again, it helps with ulcers. And then the next thing it does, it actually improves the integrity of the mucosal lining. So your gut is made up of what's called as tight junctions. These tight junctions are kind of like linked like this. But when you have inflammation within the body and you have gut dysbiosis, these tight junctions start to like separate like this. And the significance of that separation then is that all that food particles can get through those tight junctions that are no longer tight directly into the bloodstream before they are broken down in the stomach. And the problem with that is that the body sees that as a foreign invader. So then you get what's called as like this mast cell activation, where the body is just doing what it needs to do in terms of like attacking those foreign substances. And that mast cell activation triggers inflammation, it triggers immune system dysfunction. And if it stays in that chronic state, because this is always open and you're eating 3 meals a day and you're constantly bombarding yourself with food particles, it starts to wear down on the whole energy system, and you just are depleted of resources, so your body just doesn't heal more efficiently. So taking that BPC, where it starts to improve that mucosal lining, it starts to bring those tight junctions back together. And now each time that you're eating, you're not getting that assault within the body.
Hmm. Well, thank you for touching on that. And for for someone who is trying to heal the gut lining specifically, would you recommend the oral version? Would you recommend the injectable form of BPC? Which one would you opt for?
I mean, honestly, I would say try them both and see which ones like your body specifically responds to the best. The best way is to either add the BPC injection or oral version. Just like, and honestly, I would have both on hand, because like life is busy. Let's say like you plan like a spontaneous trip, you want to take some BPC with you. Taking the oral version is incredible for travel. So I would honestly have like both on hand personally, but then try them both, because each person is going to respond a little bit differently. Some people, the oral is all they need, and it's great. It works great for them. They don't have to do the injection. Some people need a little bit stronger of a chemical signaling, so they need more of the injection base. So it just depends on like where you're at, which one's going to help you the best in terms of that. So I would say, honestly, say try both. They're both going to help because the way they've been synthesized.
Hmm. You touched on BPC and how it helps with inflammation. Now I know fat has the reason I even brought up lipolysis is because fat has multiple functions, right? It's a shock absorber, excuse me. It's an energy source, and it also holds toxins. So during the time that we're shrinking the fat cells, we're releasing a lot of toxins, which contribute to inflammation within the body. So can you touch on that a little bit more on how BPC and TB500 help with inflammation, especially as you're losing weight and you have this release of toxins in the body? I mean, we're bombarded by toxins all day and every day, anyways. But can you elaborate a little bit more?
Well, so they're each going to work similar but different. And the difference of how they're going to work is BPC is actually organ protective. In terms of the fact, like BPC is so organ protective that it has been shown to protect the liver like after consumption of alcohol. Like that's how protective it is. And as you're losing the fat, the toxins that are stored in the fat have to go through the liver for processing. So that's one way that BPC is going to help support your organ systems to kind of act as like a buffer as your body is processing this. Also, too, BPC is also neuroprotective. So it's actually going to protect the brain just in case any of those toxins get close to crossing the blood-brain barrier as well, too. The next thing that can happen is with those toxins being released, again, it can set off an immune system response between your TA1 and TA2 immune system function. This is where the TB comes into effect because this is more of the immune modulator. The two most powerful immune modulator peptides are TB500 and TA1. So the fact that they're paired together, you're dealing with the inflammatory response, organ protective response, and then you're also buffering from that inflammatory response that's triggering that immune system dysfunction. So you're allowing the body to slowly do it. And then as the person starts to unload those toxins and get farther along their weight journey, it's going to be easier and easier for the body to process it. Yeah.
Thank you. I just want to ask some of the questions that have come in. So, someone said, so you definitely need to cycle BPC on and off. You have to cycle. Can you elaborate on the cycling process and what you typically recommend?
Well, I like to cycle for a couple different reasons. Is one to get to reset a baseline of understanding like where that patient's at, because the BPC and the TB500 can actually help decrease almost like immediately like where that pain is. So it can act as like a pain buffer. When someone is on it for so long, sometimes you can forget how well it's working. So that's why I like to do just these 8 to 12 week cycles with a 4 week off because you can really understand how well it's working. Because if you just keep chronically doing it, eventually you'll get to a point where you're like, I'm not sure if this is doing anything or this is working anymore. But that allows you every 12 weeks to reset a baseline to be like, oh, wow, like I do feel very different when I'm on that BPC 157. I do feel like my body heals better. I do feel less pain. I do feel less inflammation. So then I like to work on a different system. And that's where I'll add, like, again, like a GHK or a growth hormone peptide or any type of like mitochondria peptide because I want to improve other systems for that 4 weeks. Because once you do that and go back to the BPC and the TB, it works even better like the second time that you take it.
Mm. Well, thank you. Now let's talk about pain, recovery, injuries, training. For someone recovering from injury or intense training, how soon do you typically see results with peptides specifically? Let's talk about BPC in this case before we touch on GHK.
So it depends if it's like a chronic injury that someone is dealing with. Let's say, like, they played baseball in high school, they have a rotator cuff injury. They're now, 20 years away from that. So there's probably significant of scar tissue. There's imbalance of muscle. So that's more like a chronic case. Or if I have someone who they just kind of like push themselves too hard in the gym and they're like sore the next day, more of like an acute case. It's very different. For the acute cases, you can literally just use like BPC by itself, and that one is going to help people because again, that's helping with the ligaments, tendons, joints, and the inflammation and healing up that wound response. But with these chronic cases, you always have to address the immune system. And that's again where that TB comes in. And with that being said, I would always use whether it's acute or chronic, I would always pair that TB with it anyways, is because TB 500, along while BPC is healing the ligaments, tendons, and joints, like let's say from like that rotator cuff injury. But again, there's significant scar tissue that's been built up in it. So TB 500 actually reduces the scar tissue formation. And then with the acute injury person, the reason that I would use TV 500 for that is that inhibits the formation of scar tissue. So then we can either be like proactive with, someone's very active and or injury prone, and we can help them from building up that scar tissue to maintain mobility. And then we can also use someone in a chronic case to decrease that scar tissue because typically the scar tissue in that lack of mobility is the reason why that person keeps over injuring that joint over and over again. So with adding the BPC and the TV 500 and decreasing that scar tissue, healing the joint, the ligaments, the tendons, you're going to decrease the amount of re-injury for that joint as well too.
And we'll talk about GHK's role, but I'm looking at the chat and some of the questions that are coming in. Best peptide for Hashimoto's in general. My Hashimoto's is in remission. GLP, GIP, BPC, TB 500. Do you recommend BPC for Hashimoto's?
Again, that's like Hashimoto's is like complicated, but it's not complex. What I mean about that is typically when you have a thyroid issue or a thyroid dysfunction, it doesn't mean that it's the thyroid itself. Again, we got to kind of look at the three tiers of what's happening. So, chronic inflammation is kind of like the start of everything that cascades within the body. It's like that first domino that goes down. Once that domino, that inflammation starts, again, we start to see the immune system dysfunction between that Th1, Th2. So, we can see either hypo or hyperthyroid function. So there's a bunch of different ways that we can approach it. We can microdose the GLPs. We can add the BPC and TB 500 to that as well too. We could do the GLP with the Semorolin, but each of those are going to improve the overall health of the body, which eventually is going to throw into submission a lot of these quote diseases that most people are diagnosed with. So it's really about peeling the layers back because again, you just didn't get into this Hashimoto situation in and out of itself overnight. This was a buildup of things that are going on. So whether it's like Hashimoto's, diabetes, rheumatoid arthritis, there's always kind of layers through these things. So that's where I like to, give your body like a 9-month period where you're cycling through a couple of these peptides, the healing peptides, plus a low dose GLP, and then cycling to these growth hormone peptides and just kind of going back and forth a few times. And you typically peel back enough layers to where it just starts to resolve. Because again, there is so much spillover from each of these peptides.
Yeah, I'm trying to monitor the chat. There's a lot of questions coming in. Trying to catch the ones that are relevant to our conversation right now. But someone wrote, just logging in not too long ago, what is the peptide good for reducing scar tissue? So maybe that's a great segue into talking about GHK-Cu, but maybe we can you can answer that.
Well, your best one in terms of reducing that scar tissue is that TB 500, but then in terms of like the repair and the renewal of like the collagen tissue and collagen fibers, that's where you're going to add that GHK-Cu into the mix as well too. And I've been seeing around social media, everyone's been talking about like the glow mix right now, and it's like new to them. And I'm like, you're just all finding out about this now. And the glow mix refers to BPC, TB 500, and GHK-Cu because again, there's so much spillover GHK-Cu It's a copper-based peptide. Most people know it for skin regeneration or tightening of the skin. But there's a lot more other magical things that it does. It's like so powerful for the skin that you could use it with, you know, ulcers, diabetic ulcers, to help regenerate the skin for diabetic ulcers as well too. That's just like the outside of what it's doing. The inside of what it's doing is it's actually helping to increase stem cell production and migration, which the body needs in order to renew the tissue. So the reason that it works better when you combine these together is because when you add these together, it helps each one to actually work deeper in the system. For example, there is crossover between GHK-Cu and the skin regeneration and reducing the scar tissue, and also like helping with hair restoration. Actually, TB actually helps with hair growth as well too, and that scar tissue formation. So again, there's like so much
I love her.
overlap that when you combine them together, you really start to see the synergy of how they shine, because they don't, again, traditional medication is just like everything's in box. You take a statin just lowers your cholesterol. Take a blood pressure medication, just lowers the blood pressure. These things, again, are working holistically and synergistically throughout the entire body. That it's kind of hard to tell like how each patient responds. So, I mean, for example, I had a patient who he wasn't using it for the skin, he wasn't using it for hair restoration, but I put him on that tripeptide mix, that glow mix, because he wanted to golf and he didn't want to have hip pain anymore. I put him on that mix, and he called me like 5 days later, and I was like, "Oh, great, what's he calling about to complain about this time?" He was like, actually like super happy on the phone. He was like, "Hey, Dr. J, like I just want to tell you, like I don't wake up with hip pain anymore." And also not only that, but my mind feels like it's clear and like it's working better. So there's so many downstream effects that, patient comes in with symptom A or problem A, but it helps them with like X, Y, Z, and T over there as well too. So it helps them with all these other problems that they didn't even realize that they had.
Yeah, mental health is a tricky one to talk about, and in no way is this considered medical advice. Like you need to, seek medical help. But we were talking about depression and how BPC TB 500 can help with a lot of these sort of mental health um, issues. Maybe just touch on that a little bit.
Well,
The
with
research you're
with
reading and seeing.
mental health, that's a great question, because there could be different etiologies. What I mean by etiologies is there are different causes or triggers for the mental health issue. Now, in terms of like the BPC and the TB 500, how it can help with the mental health issues is sometimes depression or anxiety is actually triggered by the inflammation of the gut, where we were talking about where those tight junctions become loose.
The
And you have
second brain.
what happens is that gut becomes inflamed, and then it's directly connected to your brain through what's called as the vagus nerve. There's a direct highway connection. When that vagus nerve is irritated, it causes that neuroinflammation. And when the brain is inflamed, it brings you to a lower level or lower energy state or depression. It depresses you down. That can be like one trigger of the depression. So when you fix that or improve that with the BPC and the TB 500, it kind of like lifts you, and it's like you're just like clear, and you're just, I don't know, happy. But then again, it's a very complex thing. It could be related to trauma, it could be related to situation. So there's many different layers, but basically by using the peptides, it makes your body more resilient. So let's say like you're going through life and you do go through a hard time. That those peptides are going to make your body more resilient to where you can actually respond to the stresses of life in a positive way, as opposed to like self-sabotage or kind of feeling like you don't have power to respond to that. It like makes your cells stronger, because like we're all going to face hard times. Like no one's life is like sunshine and rainbows. Like no matter how well we like put on this face and say everything is good, like we all have stuff like internally. We all have like these negative dialogues going on in our mind. Like we all just like want to feel seen and worthy, and we all just want to do things and to help people. And Sometimes things go your way and sometimes things don't. But again, by being able to build that resiliency by using these peptides, it allows you to stay calm in the midst of the storm and actually able to bounce back faster when you get knocked down. Because like you're going to get knocked down, but it allows you
Yeah.
to respond in a way that you can get up faster and stronger than what you were before.
Yeah. It's like fighting a virus with a stronger immune system. That's how you go. So let's take it back to an injury. I have injured shoulder or hip or whatever it may be. There's chronic pain, inflammation in that region. Um, so should I inject the BPC and potentially GHK-Cu into that region? Where, or if I inject it in my gut, will it travel to the site? Can you talk a little bit about injury, and how we can manage that best?
Yeah. So again, there's just like different trains of thoughts when you talk to different practitioners. Everyone's going to give you a different answer based on their experience. My experience is if you do have like an extremity issue, whether it's a knee, ankle, shoulder, joint, I do like to inject it close to the site of injury. I feel like it has a little bit more power, but if you do not feel comfortable injecting it close to the site of injury and you do want to inject it into like the abdomen or the lateral glute, it is going to travel most of the way there, but you're going to get a more powerful effect if you go like straight, like close to it.
Mhm. Um, what peptides can we use alongside BPC and GHK-Cu? What other peptides can
Oh,
we
I plug
use
my,
along?
it's going to die in two
Yeah,
seconds.
this is a question that came in.
Technical difficulty. Okay, still no power. Okay, well, I should be fine for the next couple minutes. Again, there's different ways that you compare, different ones that you compare with the BPC and the TV500. You can again pair that GHK-Cu because now it makes it like this super healing concoction because there's a lot of overlap. But then you can also pair it with the growth hormone peptides like Somorelin because it's going to amplify the growth hormone production in terms of the receptors of how much it's going to kind of soak it up. So you can like pair back and forth each one and see how like again which one your body needs and how you feel. So like try one round, pair it with the GHK, try another round, pair it with the Somorelin, and kind of see like how your body feels and again how you respond. Because I don't want to be like dogmatic, like always pair it with this or only pair it with that, because everyone has their own unique biochemical makeup and everyone has their own needs. And no matter like how much information I give you, how much information the experts give you, like you know your body better than anyone else. So this is where you need to experiment and use education to best see what your body responds to. So both pair beautifully with them in different ways. I personally, what I like to do is I pair the growth hormone ones with the BPC because that's based off of like my goals. My goal is muscle growth and preservation as well as like recovery. So that's my goals. If your goal is more like skin regeneration, pair with the GHK-Cu. So again, it just depends on like your goals of what you have.
Mm. Let's touch on NAD and glutathione. I know we have 10 minutes left. Can you tell us what is NAD? If you're hearing it for the very first time, you're hearing everyone on social media talk about it being the longevity medicine of our generation. But tell us what is NAD, and then we could talk about glutathione after that.
Yeah, sorry, I'm gonna try to plug this in real quick. There we go. All right, so NAD, it's a precursor to ATP. And ATP is the energy currency within the body. And as we start to age, your body starts to produce less NAD within like these different cycles. For example, like a Krebs cycle, we produce NAD. I'm sure everyone remembers the Krebs cycle from high school. Like I'm sure everyone could tell me how many NAD that they produce. No, I can't. I can't even tell you that. But so NAD is going to affect so many different pathways within the body because it's used almost like within anything. It can help some people with energy. It can help some people with those detox pathways. It can act more as like a neuroprotective. So I know everyone knows NAD from the longevity space, but that's not where NAD therapy first started. NAD therapy first started with addiction, started with alcoholic and drug addiction, where people would go get these 8-hour drips of NAD because it was so powerful from resetting things neurologically that it would decrease the withdrawals as well as decrease the symptoms and decrease the likelihood of that addictive behavior. That's where
Mm.
NAD first started. It did not start with like the longevity. It just was like after that, people started to see the longevity aspects of it as well too. So it goes like way beyond that of just like the longevity aspect. Now, glutathione,
So NAD is this precursor and it starts to drip and decline as we get older.
yep.
So what does supplementing with NAD do for our bodies then? What can I expect?
I
Increase in
mean,
mood, energy, what else?
again,
Focus.
people could feel an array of things because depending on where your biochemistry is, some people take it and feel a mood boost right away because they have that energy. So it's like think of like your battery. Your battery is like dripping, it's leaking, it's leaking, and it's leaking, and you're at like 20% battery, just like my computer was at like 5 and it was about to die. NAD is like charging that battery up. So some people again can feel the energy production, but then you also need that energy for detoxification. So in the beginning, again, depending on where you're at, you want to be on it for at least like 12 weeks to let your body kind of like stabilize with it. Because the first 2 weeks, you might actually feel worse because your body's like, wow, I have this energy. I can actually detox now. Or wow, I have this extra energy so I can actually like think clear now. Or wow, I have this energy now. I can actually sleep differently. So again, there's not like a one blanket answer for this. It's because it's used for every function within the body.
Hmm. Hmm. So it's making all the other processes more efficient. It's that high energy token that you need that
Okay,
depletes over time.
everything else work better. I
All right.
personally like the NAD nasal spray. That's my favorite. I will take that like either like pre-workout because it drops me into a glycolytic state. So I'm actually like using more glucose more efficiently. So like my workouts are better, or I will use it if I have like a very cognitively demanding task. Like if I'm traveling and I need to be like very sharp mentally, for me, the nasal spray helps me a lot, like stay mentally sharp for long periods of time if I need to do some deep work.
You touched on NAD being used for addiction and alcohol symptoms and withdrawals. I know there's a couple people here, like whenever they go out drinking, they religiously take their NAD and glutathione. So let's talk about glutathione. What is glutathione and what does it do in our body?
So glutathione is it's considered the master antioxidant of the body. What an antioxidant is it helps with free radical buildup. Free radicals are these positively charged particles within the body that basically cause rust within the body. And as our body again gets burdened or lower energy, your body is producing less and less glutathione from the liver. That's where it's produced. And if our body is not producing enough glutathione, this helps with toxin removal. I mean, we're coming into contact with toxins all the time. I mean, I just read a study where they're like, oh, actually, you're getting more microplastics from the glass bottles than you were the plastic bottles. And I'm like, Jesus, man, like we keep seeing that, like where all these toxins are coming, or they're like the receipt is actually like super toxic to touch because it has like BPAs and it gets into your skin. So your body has to detox that and it has to produce glutathione in order to detox that as well too. So with taking or supplementing with the glutathione, again, it acts as a buffer from everything that we are constantly being bombarded with so that your body can run more efficiently, so it can run clean. Again, we touched earlier on how your body stores toxins within those fat cells. So as your body is losing weight, if you supplement with glutathione as well too, it's going to help kind of take the ease off the body system. And what that is people say that, oh, my skin is better after I do that. Well, yeah, your skin is an organ, and if your body's detox systems are clogged or not working efficiently and you're not producing enough glutathione, your body starts to push out those toxins not only in the fat, but it starts to push them through your skin. So that's where people are seeing the indirect effects of the glutathione improving skin, like the features of the skin, because it's helping the body be more efficiently with the detox pathways that it doesn't have to push it out through the skin.
Mm. And they call it the glutathione glow for a reason. It helps with hyperpigmentation. It helps with. Now, talk to us about glutathione and inflammation. A lot of people take it for inflammation specifically. Um, Tell us what it does
Yeah,
there.
well, again, like those inflammatory cytokines, your body has to process that through the liver. And again, glutathione is like that master antioxidant that neutralizes a lot of those inflammatory processes as well too. So again, like there's not just like one thing that knocks out inflammation. GLPs knocks out a little bit of inflammation. BPC TB knocks out inflammation in its own way, and then glutathione helps knock out inflammation in its own way. So again, it helps with a lot of those byproducts. Inflammation is not just harmless by itself, because when the cells or the tissue is inflamed, it's producing a lot of toxic byproducts. Those toxic byproducts again have to be processed by the body, and the glutathione helps process those toxic byproducts of that inflammatory response.
Mm. Guys, if you want the best skincare, GHK-Cu injections, glutathione, and the Ellie topical Skin Plus, like you'll get the glow, hyperpigmentation gone. And it seems like it does way more than that. I mean, your skin's the largest organ, so it's obvious when things are being filtered properly, inflammation goes down. Um, your skin shows all the benefits. Now, let me see, let's go through some of the questions with the few minutes that we have left. Let's take this one. This one's a good one to answer. Who is the ideal candidate for GLP-1 B12 injections?
Wow, such a
Well,
loaded question.
let's talk about microdose versus weight loss. How about for microdosing? Who would
Okay.
be an ideal candidate?
I mean, the microdosing is going to be like you lost the weight, you just kind of want to maintain that weight loss that you achieved, and then you want to dip more into like the longevity benefits of the GLPs, because really what the GLPs at a cellular level, what they're doing, again, they're improving cell function, and they're improving cell functions in multiple different levels of tissue, everything from liver, kidney, cardiovascular tissue, and it's also neuroprotective as well too. So you're getting so many benefits in terms of the low dose, the longevity benefits. Just because again, our
Mm.
bodies are assaulted by so many assaults from 1,000 different ways. So we're dying by 1,000 cuts basically, because like the food, the air, the water, everything is kind of like not in line with our own human biology. Now, a great candidate, obviously, again for the higher doses is your weight loss.
hmm I'm getting a lot of this question, and it's a repeat question, which means that people need answers for it about cycling on and off peptides. So, number one, which peptides do we not have to cycle on and off for of? And then number two, when it comes to BPC, GHK-Cu, glutathione, NAD, it seems like what I've read, the literature, the consensus, what you recommend is 12 weeks on, 4 weeks off, generally, correct? Is that like the recommended protocol across the board?
To keep it simple, yes, that's typically like the recommended protocol, like that 12 weeks on, 4 to 6 weeks off, again, give or take. This is where, again, I don't like to have medicine black or white. It's very much like gray and specific on the patient and how they're responding. But for simplicity of the matters, 12 weeks on, 4 to 6 weeks off. Most peptides you're going to want to cycle on and off. You're not going to want to be on them long term. Now, different ones that you could potentially be on longer term, depending on like what we're doing, is, like a low dose GLP, where because you're just literally giving your body a micro signal over time. You're not giving that higher signal when we're losing that weight. The other one that you can be on a little bit longer, you could have consistently in your stack, is like an NAD or like a glutathione, because you're not going to take those. So you're not going to take those like every day or frequently. Most times I'm having people take, glutathione on their rest days if they're working out, or on the weekends for repair and recovery. And then I'm having them use NAD maybe like 2 or 3 times a week at most, just to keep like that battery filled up. So those are ones that you can definitely like do longer, but I'm a big fan of cycling on and off all pretty much all the other ones. And
So you
there's
could cycle it on for like while you're taking your NAD. Once you come off of it, you could take your glutathione once you're so you could. And then can you talk about stacking? Because it's believe it or not, I find that in our community, it's a very new term for a lot of people. They haven't heard the term stacking, and that yes, you can put multiple peptides in one syringe and inject yourself. So can you talk to us about what this term stacking is in the peptide community?
so
What is safe to put in one syringe?
yeah, I mean, what all I'm meaning about stack when I say stacking is I'm using more than one peptide. I'm creating like a cocktail of peptides instead of just using like the GLPs. I'm going to add, the growth hormone peptide. So that's considered a stack. Or I'm going to use some Morlin and BPC TV500. That's considered another stack because I'm using two different peptides that are in two different vials at the same time. And you can, to cut down on the injections, let's say you're using the BPC TV500 and that's Morlin, you can literally put them in the same syringe because you're going to be injecting it within like the 30 seconds of taking that. I wouldn't take it out of the vial of the BPC and put it into the vial of the Samorlin. I would still keep them separate because there is a little bit different in the stability of how some of these work. But if they're in there for like a minute or so together in one insulin syringe and you just cut down on the injections, it's still pretty stable. It's just like long-term storage. You wouldn't want to put them in the same vial.
And what is your current stack right now? Last question. What is your stack? What is your go-to stack? And
It's proprietary right now. It's experimental right now.
okay. I typically do NAD, BPC, and a small amount of either semaglutide, tirzepatide, and sometimes C-Lang C-Max. I love that one for
Yeah. I'm on
to,
BPC TV500. I'm on a growth hormone peptide, and then I'm on GHK-Cu. I'm on all of them right now. So
okay. Well, awesome. Thank you so much. Thank you all for tuning in on a weekly basis to learn more, educate yourself. This is the best part of our community, the educational series. And Dr. Wagner, thank you for coming on and helping us learn more and disseminating the information, breaking it down and educating all of us. Thank you so, so much. Thank you all. And tune in next week for another educational series. We might have a surprise for all of you. So be sure to tune in next week, everyone. Thank you so much. Good evening and good night, wherever you are. We love you. Mwah. Thank you again, Dr. Wagner.
thank you so much, honey. Take care.
Thank you.